So let's jump into Chapter 5 in our book, the Affordable Care Act. This was very, very popular and a hot topic about 10 years ago because it was something new. It was designed so that everybody, all Americans, would have equal access to health care. The theory is, or still is, that if individuals have health insurance, healthcare cost is less expensive, even though it costs money to have health insurance. So let's dig into this chapter. The Patient Protection and Affordable Care Act. There are 10 titles within that act, and each one of them have their own separate role or separate purpose. Very important to know what they are and how they serve us as health care insurance consumers, and also if we were providers and nurses and any type of doctor's office. So please read this chapter and just become familiar with what each title is meant for. Some of them, the names of the titles are self-explanatory, but some of them are not. Okay. I'm just going to read through the chapter, and we'll flip through the chapter. Page 74, we have Title 1. The most important thing to know is that this was designed for individuals. The whole purpose of this was to serve the people of the United States better regarding their health care. Title 2, role of public programs. We have discussed Medicaid before. That's listed. The Children's Health Insurance Program is listed. Title 3, improving the quality and efficiency of health care. They like to incentivize physicians, nurses, any kind of primary care provider to improve care given. For so many reasons. Of course, we would want to improve care. We just don't want anybody left out. Title 4, prevention of chronic disease and improving public health. Kind of self-explanatory. Title 5, healthcare workforce. So what do we do when we live in rural towns? Which, Wilson's considered rural, but there's lots of us that live on the outskirts of Wilson. We're 30, 45 minutes from Raleigh or a major city, maybe even longer than that. That's considered rural. How do we get healthcare workers to come to rural cities, or not cities, rural settings and actually work? And so the government decided to offer scholarships, loan repayment plans, that type of thing. Even as a nurse myself and an instructor, there were small opportunities to pay just a little bit of money back on my student loans if I would teach in rural settings. And since I live rurally, I'm very passionate about our rural areas. So of course I accepted an offer when I first finished. I'm still paying on those loans, but that nice little loan repayment offer was definitely incentive enough for me to go or stay in my rural community and work. So that's Title 5. Title 6, transparency and program integrity. This is, of course, a huge deal. We all want to know what we're getting into, what we're being told is actually going to happen. So integrity is very, very important. Title 7, improving access to innovative medical therapies. Again, some promoting of innovation there to improve outcomes. Title 8, Community Living Assistance Services and Supports Act. We want to make sure every American has an option for long-term care services. Title 9 is revenue provisions. How are we going to pay for this Affordable Care Act? Which, who can get tax cuts to help with the burden of the cost of health insurance and health care. Title 10, reauthorization of the Indian Healthcare Improvement Act. That is a community of people who are, not only do they live rurally, but quite the minority and underserved in many ways. So the Indian Healthcare Improvement Act was included in the Affordable Care Act. So the timeline of the Patient Protection and Affordable Care Act, which, by the way, I keep saying Affordable Care Act. That's interchangeable. So the Affordable Care Act is the Patient Protection and Affordable Care Act. They changed the name. So it's all the same when I keep saying these different names. So the timeline of the PPACA in 2010. This is when it was enacted or insurance coverage became online for consumers to buy. Rules changed, of course, every year almost since then. There's been a change for improvement. The biggest thing back in 2010, though, is you could not deny coverage. So that was huge when all of this was rolled out. So many patients had so many underlying issues, whether it would have been cancers, genetic diseases like cystic fibrosis, those especially kids, you couldn't get health insurance for those people, but they had a chronic illness, so it just didn't make sense. So in 2010, this was instituted that you could not deny coverage. 2011, here comes some more improvements, definitely quality. Wanted to make sure that the insurance companies who were receiving these premiums were doing what they should be doing with that money. The chapter goes into that. There's actually a nice little chart or table, whatever you would call it, on page 79, figure 5.1, with what happens with each year, the improvement. Value-based purchasing came along in 2012. Again, more incentives for hospitals to improve the quality of care. We all do the best we can, whether we're providers, healthcare consumers, but mistakes get made. We're humans. But there's incentives if you prevent those mistakes to the best of your ability. And lots of hospitals have improved since 2012. 2013 rolls around, and again, we're still improving quality and trying to lower the cost. Bundle payments come into play. The health insurance market was a huge, what's the word I'm trying to say? Not improvement. The marketplace came about, and everybody and anybody could buy health insurance from there. You could do it as an individual or through your employer. 2014, new consumer protection came along. 2015, again, we are improving quality and lowering cost. Then the chapter gets into the Center for Consumer Information and Insurance Oversight. So this group is organized to protect us. The marketplace was the new way to shop for health insurance coverage, but who was kind of policing them, or who was setting their guidelines and expectations? And that's how the Consumer Information and Oversight group came about. Cracking down on policy cancellation. So once upon a time, you could fill out a form incorrectly and not get insurance coverage, or just small little details like that. And this group ceased that. You're no longer allowed to do that. That is actually prohibited. You cannot do that. Doctor's choice and out-of-network services. So this was a big deal too. Once upon a time, if a doctor was not within the network, you just couldn't go to that person. But now with this new Affordable Care Act and these new groups to make sure everything was, going well, integrity, improving the quality, etc., they saw to it that we could choose our own doctors, whether they're in network or not in network. Now, there may be a difference in pricing if you choose to go to your favorite doctor who may not be in your insurance network, but that's not true with emergency care. Emergency care, if it's an emergency, you can go anywhere. And that includes our veterans, our children, or anyone who has specific insurance. If it is a true emergency, there's no penalty for going somewhere for treatment. Okay, chapter continues, policy, lifetime, and yearly limitations. So read that. That's actually pretty interesting. And if you read your own health insurance policy, read that fine print. I was amazed actually that there's like yearly caps and even lifetime caps. And if you were to have a significant chronic disease or a significant trauma, you might would actually reach those caps depending on the severity. So just look into that. It's pretty interesting. Rate review and the 80-20 rule. Filing an appeal is mentioned in this chapter also. And then summary of benefits and coverage. There is an entire bullet list there. I'm not going to read that to you. You guys are perfectly capable of reviewing that. And then the summary benefits, which is considered figure 5.4. That takes up several pages in our book. Just good information there. Bear with me because I'm literally flipping through the book as I talk to you. So now I'm on page 99, and the bullet list just continue. Speaks of what President Obama did, what could happen with the future presidents. And then we have a nice little conclusion. And again, the Affordable Care Act was just to ensure that all Americans have access to quality health care. We don't want somebody not to have access. And it's interesting enough, if you survey your peers, neighbors, family members, or what have you, in this coming holiday season that we're going to enter, I think you might be surprised at who still does not have health insurance. There are people that still choose not to purchase health insurance, and you know, it's such an impact on our healthcare system when those people arrive in our ERs or have surgery or what have you. So it'll be interesting to see what comes this year, next year, in the future as far as accessibility. So hopefully only good things to come that should improve with time. Thanks. I hope you guys have a great week.